Dr. Anna Larson is a board-certified family medicine physician with expertise in LGBTQ plus leadership, advocacy, and gender-affirming care. Her mission is to support medical organizations in creating and affirming inclusive cultures, policies, and communities that attract and retain queer and trans patients and employees. Let's give a warm welcome to Dr. Anna Larson to discuss advocating for inclusion.
Hello. Can everyone hear me? I forgot that you don't talk into this. It's a clicker. Let's all stand up. Stand up. Come on. Take a break. Okay, free stuff. Oh, yeah. Oh, yeah. Oh, yeah. Who's the biggest ally here? Make some noise. Holy moly. Okay. 1, 2. Okay, actually just pass it around. There's like a bunch of free swag. Pass it around. So they're little tiny like progress flag buttons that you can put on like your tag or whatever, like something low key for some of you folks in red states like me, where you just gotta put a little something there. And us gays, queers, whatever, we'll find it anywhere. We will find any rainbow in that room. Any pronouns on your badge, we'll find it. Doesn't matter how small they are. Okay, great. All right, thanks guys. So we're gonna start. My name is Anna Larson. I use she or any pronouns, and I am gonna talk about advocating for inclusion. Just in case you never know. Okay, so my pediatrician friend who does outreach for folks with unstable housing said that she started to see a lot of teenage transgender refugees flocking to Minnesota. And they say that they feel safer being homeless in the Twin Cities than they do with stable housing in their home states. And I'm gonna say this again. They feel safer being homeless. Like a lot of clinicians across the country, my Minnesota colleagues are overloaded with the numbers of trans youth that they are seeing. They're coming from North Dakota, Iowa, Missouri, Tennessee, Florida, Texas for their gender-affirming care. And many families have fled these states. And healthcare providers too, including those who provide this care and those who identify as LGBTQ or have families who identify as LGBTQ. My pediatrician colleague moved out of state with her family to be able to continue to provide care to her patients after her program was shut down due to state legislation. My college friend left Florida, where she grew up and owned her own vet practice, because it no longer felt safe to keep her family there anymore, because she is transgender and has a wife and young child. A therapist friend is so fearful of her right to get access for her child's health that she is emigrating to Canada. Her child is trans. A friend is a Two-Spirit Cherokee artisan who lives in Idaho who can no longer get his trans care through Medicaid. And so he's having to choose between a state with legal protections for his native rights in regards to animal parts and use for ceremony, and a state with legal protections for his gender-affirming care. There's no state that protects both. The stories I've heard and continue to hear are heart-wrenching. Raise your hand if you've heard any stories like these. Last year, over 125 bills were introduced in the state legislatures preventing trans youth from being able to access evidence-based gender-affirming care. That's not AI. I drew those circles. There were 220 bills that were introduced specifically targeting trans and non-binary people, including bathrooms, IDs, and sports teams. And a whopping 520 bills were introduced that were specifically anti-LGBTQ, including but not limited to prohibiting drag shows and education censorship. It's honestly overwhelming as a queer human being, let alone a queer parent, a spouse to a trans person, and a physician providing this care. This is my family, my Henrys. And it's not just gender-affirming care or LGBTQ rights. It's reproductive rights, immigration rights, racism, ableism, mental health care access, healthcare access. As medical professionals, we are all advocates. It's why we went into medicine in the first place. We get a lot of news, a lot of opinions about the so-called culture wars. But this is the front line. This is where the legislation lands. These are real lives of real people, and we are in pain. Let's stop talking about culture wars and talk about basic humanity. These are human rights. This country is grappling with a human rights crisis that extends beyond gender-affirming care and LGBTQ health. As medical professionals, it is our responsibility to address these challenges head-on, recognizing the real lives and real pain of those affected by discriminatory legislation and societal prejudices. But at the same time, we need to take care of ourselves. And with so many barriers, how do we advocate for our patients and communities? And most importantly, how do we do so without losing ourselves? I learned about advocacy the hard way. I don't know about any of you. I had my dream job 2 years outside of residency. I built a beautiful gender-affirming care program. I integrated HIV and medication-assisted treatment for addiction. I networked with behavioral health, and we had our own non-binary psychologist. We had speech therapists, plastic surgeons, OB-GYNs, allies within the system. We took care of trans youth and brought the wait time down from over a year to just a few months to be evaluated for pubertal suppression. Our practice was booming. We went from less than 5 to over 300 trans and gender expensive patients in 2 years, with new patients every week. The exponential growth showed the huge need for this care. We had patients traveling from outside states, and that was before care was even restricted in outside states. And we needed more support. Some days, we were so busy that I'd hold going to the bathroom all day. How many of you have been there? Oh, yeah. Yeah. Then COVID hit, and the promised support, like so many other things, was put on the back burner. Our numbers continued to skyrocket, but the support dwindled. I felt like I was personally responsible for the adolescents in our program. And that's what you do in a situation like this, when the system drops away beneath you. Like I said, that's why we went into medicine in the first place. When the system fails to take care of patients, we step in personally. These are lives at stake. we step in first. Well, we put ourselves last when the system fails. And that's what we do, but there's a cost to that also. And that's what I want to talk to you about today. But what I want you to think about and keep in the forefront of your mind are the patients. My patients. The 15-year-olds who deserved so much more. I gave them everything I wish I could have given myself at that age. Unconditional love, compassion, the ability to be their authentic selves. I did prior auths on my days off. I worked nights and weekends. I was barely holding it together. And then, oh, that's me barely holding it together. And then I had a baby. Easy peasy. Yeah, that's the baby. My spouse transitioned and the family drama ensued. That's my spouse. Trying to hold hands. And the seams burst. I lost someone. And I want to tell that story. I can still remember that morning, and I hate mornings. Not a morning person, never been a morning person. Barely made it for the run on time. Actually, I made it about 15 minutes, and then I found someone to go back with. So it was 7:15 in the morning, and I was in the room with a patient, and my old boss calls me, which is unusual, so I step out to answer. He says, "Anna, I have some hard news. Your co-resident, Jen, died. She was a part of our 6-person family medicine residency family. We were a tight-knit group. One of my other co-residents in the back. I snuck her in. I told her to wear pink. She worked in the same medical system, and he wanted to tell us before we heard it from our patients. I didn't want to ask, but I kind of had a feeling. Was it suicide? It seems so. She, of course, finished her notes and cleaned out her in-basket beforehand, just like Jen would do. She had messaged me a few months ago asking a transcare question. After I responded, she asked how I was doing. I told her about my woes of pregnancy. I asked how she was doing. She never responded. The guilt. I'd been so busy dealing with a rough pregnancy, a newborn, supporting my spouse through their transition. You kind of know the feeling if you've been there, that somehow you could have saved them with that one text or phone call. The guilt of that. Jen was incredible. Brilliant, like beyond brilliant. Hysterical, like absolutely hysterical, so funny. And in so many ways, so much like me. We both struggled in residency and prioritized the needs of our patients above our own and tried to give the world to the people who deserve so much more. And we tended to forget about ourselves. At that moment on, I knew I couldn't go on like this. I needed to make big changes in my life. From that moment on, I never waited to go to the bathroom again. And I learned for the first time about the importance of self-advocacy. You see, effective advocacy must actually begin with self-advocacy and a deep connection to one's authentic self, instead of being viewed solely as an external effort to garner support for a cause. The problem is with our definition of advocacy, of thinking of it as an external effort. It goes so much deeper than that. got to start from within, and then it's got to continue from within as we continue to connect to our innermost authentic self. Got to lighten the mood a little. A lot of LGBTQ people have similar experiences. I'd like to tell you one of mine. Okay, kind of lighten the mood, kind of. I met the parent, when I was 15 years old. My girlfriend said, this isn't gonna go well. Her and her mom used to be really close growing up, but when we started dating, they became distant. One day, in the car, her mom, noticing the signs, turned to her and said, you're either pregnant or you're gay. Her two worst fears. Her two older sisters got pregnant as teenagers. My girlfriend was definitely not pregnant. She told her mom about us. After a few rough weeks, her mom finally agreed to meet me. Now, I'm an optimist, like some of us in the audience. I can't even help it. It's who I am at my core. I think a lot of us in medicine are optimists. Maybe not all the time. But I don't think you can go into medicine or stay there without some degree of optimism sometimes. So I told my girlfriend, I said, wait a second. I'm a good catch. I'm brilliant, beautiful, kind, a straight A student, and I want to be a fucking doctor. What could possibly go wrong? She's like, she rolled her eyes. She's like, doesn't matter. This isn't gonna go over well. She was right. Her mom didn't even give me a chance. Didn't even look at me. Sat us both down on the couch and started to tell us we were going to hell. I looked over at my girlfriend and I was like, what do I do? But her hands were on her face and her face was in her lap. And I was like, oh, shoot. And so, at that point, I started to laugh. Because when I get nervous, I smile. And when I get really nervous, I laugh. And when I get really, really nervous, eventually it turns into hysterical crying. But I held it together. And I was laughing as she went on and on about her sins. Oopsies. After that, I thought, didn't even get a chance. I ruined it. It's not safe to be me. I felt rejected. I felt unloved. I felt unsafe being myself. And that was a pivotal moment for me in my life. And that has always been where my passion has stemmed from. To make safe spaces for people like me to be their authentic selves and to feel accepted. And that's also likely where some of my inaccuracies about advocacy likely stem from. I have to save the world. I have to prevent anyone I love from feeling rejected, unloved, or unsafe being themselves. But I have to save the world, not myself. 2/3 of LGBTQ youth either experienced parental rejection or did not come out due to fear of rejection. Parental rejection has long-lasting consequences, including high-risk behaviors, mental health, and physical health consequences. Family rejection actually predicts adolescents' level of depression and suicidal thinking, whereas family support is associated with greater self-esteem, social support, general health status, less depression, less substance abuse, less suicidal ideation. Among trans youth specifically, Parental support is protective against depression and is associated with a higher quality of life. And luckily, it's not all about family. Trevor Project's national survey on LGBTQ youth showed that youth who report having at least one accepting adult were 40% less likely to report a suicide attempt in the past year. And that could be an auntie, a cousin, a best friend's parent, teacher, nurse, PA, physician like yourself. The closer it is to our personal lives, oh shoot, okay, that was me being sad. I think we're caught up. The closer it is to our personal lives, the more we should do it, or at least sometimes that's how I feel. I gave a really hard talk last year. Even my jokes didn't land, and I thought they were pretty good. Let me paint you a picture. It was outside of Branson, Missouri, about 4.5 hours away from where I lived in Kansas City. And I couldn't get off work the night before or the day before, so I drove through the night after work. And I was gonna get up early and meet some allies, and it was gonna be great. My optimism was showing again. So, in the morning, I put on my suit to get ready for the talk, and the pants weren't there. And not just that, like, no pants were there. The only pants I had were the pants I was wearing, which were my Just Do It sweatpants with the highlighter orange check mark on the front. And I looked at them, and I was like, okay, just do it, huh? Can I? But my friends were like, no, be careful, Anna. So I had their voices in my head. So I said, okay, I'll forego the allies. And I drove to the nearest shopping center, got a suit, and made it right back in time for my talk. So I opened the talk explaining about my Just Do It sweatpants, and no one laughed. I mean, like, not even a chuckle or even a, nothing. You could cut the tension in the room with a knife. This is the first gender-affirming care talk this organization has ever had, and it was a surprise to many that it was accepted. So in any case, you can picture the room, jokes not landing, in the middle of the country in rural Missouri, and there were family medicine physicians who asked some questions that weren't actually questions and made some comments that hurt my heart. And later I was told that the talk actually went okay. And somehow I managed to pull it off and explain that restricting care actually does the opposite of what we all want. And so I used their comments to educate and explain. But after the talk, all I wanted to do was cry. I realized it was that part of me who wasn't given a chance that was so hurt. That 15-year-old part of me. And that part was worried about rejection. And so I said, you don't need to be worried about rejection anymore, because I accept myself fully and invite you to be yourself fully. And so I provided compassion to that part. I said, we're an adult now. We're making the world a better place for us. And with that, my whole body relaxed. And that was the inner work I needed to do to continue this work. Because when I have my own back and I attend to my parts and my pants, I can do anything. And if you meld self-advocacy and inner work, you can do anything too. I want to end with where I am now. Last year, I won a spot to a retreat in Bora Bora. I know. I still can't believe it. And it was a running joke of the family that it was a scam, so no one else believed it either. But here's the proof. It's real. It's real. And so I'm in Practical Paradise with 66 other physicians, supportive women physicians. And there's something about other people, I feel like, kind of like here, being their most authentic selves, that allows you to be your most authentic self. And so we're all sitting together and journaling and sharing our stories and crying and talking and hugging and all those things. And I stood up and I told my story. And it clicked for me that being authentic about my gender identity kind of was everything. And somehow I decided to come out as gender fluid and not hide a part of myself that might be seen as less okay in our society. And the other doctors at the retreat started to do the same. Not about coming out, but talking about other things. We weren't all gender fluid. At least not that they said. But we did go use both bathrooms because it only made sense. It was like all of us there. Why two different bathrooms, you know? Any case. And then I could see it segueing into the next part of my career. And it took that experience to show me that authenticity is the next piece. And I started to talk about my passion in medicine and my dream. And Cultivate Pride began, where I educate others on gender-affirming care, and I mentor physicians and residents, and really anyone who wants to learn gender-affirming care or how to be inclusive in their practice, and guide systems on ways to be inclusive. And it's been amazing. I've been able to kind of see the ripple effect of more safe spaces, like throughout the country, in Georgia, and lots of places in the South where I trained. And it's been a dream for my 15-year-old self. But it's more than that. There's something deeply healing about being your most authentic self that lights a fire in your soul. And by being your most authentic self, you will transform your world, and your world will transform around you. And so here's what I learned true advocacy is. At the base, self-advocacy, always first and foremost. And then the inner work to connect to our parts. I did a lot of IFS work and therapy, but there are many ways to do inner work. Therapy is a big thing for me, but I've done coaching and meditation and lots of other things. And at the top, authenticity. And the freedom and permission to be your most you and allow the world to change before your eyes. Thank you.